The drug companies who make antidepressants played down the risk of withdrawal in a couple of ways. Number one, they coined the euphemism discontinuation symptoms, which makes withdrawal symptoms sound far less daunting. To me, it's a little bit like describing a car crash as a discontinuation event involving a wall. And the second thing they did was they conducted studies on stopping antidepressants after just 8 to 12 weeks of people on the drugs. When people stop the drugs after a few weeks, they mostly have mild and self-limiting symptoms. And drug companies wrote a lot of papers about these patients, distributed them to numerous psychiatrists and doctors around the world, and they entered guidelines. So the guidelines now say that withdrawal effects from antidepressants are mild and self-limiting. However, the longer people use antidepressants, the more you become accustomed to the drug, the harder they are to stop, the more severe and long-lasting withdrawal symptoms are. So to me, this is a bit analogous to a car company crashing a car into a wall at 5 kilometers an hour and saying it's safe, and ignoring the fact that people are driving around at 60 kilometers an hour. And that this means that guidelines, whilst accurate for short-term users, are largely irrelevant for longer-term users and greatly underestimate the risk of withdrawal effects in long-term users, of which there are more and more in America and around the world.